Yes, hello. My name is Michael Lichtenberg from Arnsberg Vascular Centre. It's a pleasure to be here today and discuss about the SELUTION drug-eluting balloon studies. So the SUCCESS PTA study is the study I would like to introduce you today and give you an update on this study. This study is a study which analyzes in a prospective fashion within a global post-market surveillance, the efficacy and safety of the SELUTION drug-coated balloon technology, as we need more data for this very exciting new drug-eluting technology. Objectives and design of the studies is a very easy concept. It's a global post-market surveillance study of the SELUTION drug-coated balloon angioplasty device, analyzing safety and efficacy for above the knee and below the knee interventions. So to collect real-world safety and efficacy data with 723 included patients in 27 sites around Europe. The primary endpoint was defined as the clinical-driven target lesion revascularization at 12 months. So in terms of efficacy, again, clinical-driven target lesion revascularization at 12 months showed in a very interesting news analysis stratifying between above the knee and below the knee, very positive outcomes. So the Kaplan-Meier analysis, which we just showed at the CIRSE Congress, showed a freedom from CDTLR for the above the knee group of 91.4% and for the BTK group 89.3%. So setting this in perspective to other registries which reported in the same way on paclitaxel efficacy outcome, I definitely need to admit that these are one of the most promising data for drug-coated balloon technology. I have to state that we included very complex lesion as well here in this study. So the mean lesion length in this study for above the knee was 133 millimeter plus minus 105 millimeter, and for BTK lesions 106.9 plus minus 81 millimeter. So quite realistic lesion lengths, very complex lesions were also included in terms of CTO and calcified lesion. So it's an all-comers registry showing very positive data in terms of efficacy outcomes. Conclusion of this registry, which we draw and which we showed at CIRSE Congress, this is the first report so far analyzing a stratified outcome actually for patients with above the knee and below the knee. So that means that we have definitely shown now also for BTK patients very positive outcomes for the first time actually for the SELUTION drug-coated balloon technology. This is ahead of the randomized trial, which is still ongoing. Patient recruitment is still ongoing. But this all-comers registry proved a very good clinical efficacy of this SELUTION drug-coated balloon technology, beside of very positive safety issues. Of course, after 12 months, safety issues, especially in terms of mortality rate, we do not expect any serious issues here. But I need to say in terms of major amputation, we only saw very few major amputations in this, especially also BTK cohort of just 5.2%, and for the above the knee group, just 0.7%. And also the major adverse limb event rate was quite low. For BTK, it was just 20 of 98 patients, including many and definitions, of course, for major adverse limb events. So we are on a good track, I think, with especially BTK freedom from CDTL 12 months of 89.3%. So I'm very eager to see the 24 months outcome data very soon, which we hope to present next year. So the next step is, of course, to see hopefully very soon the prospective randomized data from the two prospective randomized studies from the SELUTION SFA and BTK studies. The SFA studies has finalized the recruitment, so we will hopefully see very soon the first outcome data from that. The BTK study, as mentioned, is still recruiting. So the SFA study will be also the approval study for you in the United States.